what we're doing this year is really extending this idea of determining prognosis from multi-gene signatures, not only prognosis of the first 5 years, but we actually have several abstracts that will look at late metastasis predicted by multi-gene signatures. We will also be host to an extremely important satellite symposium that will be shared by all of the major multi-gene signature companies, biotech companies, that will look a little bit at how are these signatures actually used in the daily clinic. So this is going to be a different discussion that we're going to have. But the largest part of the meeting is really going to be dedicated to the heterogeneity of metastatic breast cancer.
And that's a very important issue where we will be discussing how we study that, how we biopsy that, is it right to biopsy that disease, and that has direct effects on the programs that are happening with cooperative groups around the world, taking metastatic material, profiling it for the individual patient, trying to identify those changes in the tumour that are actionable, as we say, and can directly inform which clinical trial approach that patient should go into, and see if we can better treat their disease with modern therapy. It's the approach that the science of those at IMPAKT have designed, but we now need to make that work, and we can take that forward. As an oncologist, I think we also want to know when we have an exciting new targeted therapy strategy. Preclinical data are telling us that the cancers very quickly can reprogram or rewire in the face of that inhibition of target, and use different pathways in order to retain their cancer phenotypes. And we need to know, through bringing together science and clinical trials teams, how we understand where that rewiring happens, how we stop it happening, and how we prove that that is a better therapeutic strategy. That is a design piece that can happen out of a meeting like IMPAKT, that directly leads to new ways of designing a trial, that we would hope lead to new protocols in the course of the next 1 or 2 years, and will change outcomes for patients in the next 5 to 10.